Welcome to our presentation on the enteric coating drugs. This presentation will basically focus on why the need to provide a certain medication in its enteric coated form and also some of the applications of this method in clinical practice. There are different types of oral dosage forms that are available for drugs that are given orally, per os, or PO. This include drugs that are administered PO can be given via tablet, boluses, powders, pellets, capsules, granules, syrups, solutions, suspensions, and paste. We also have other specialized delivery systems that include enteric coated tablets and sustained action or controlled release preparations. Why do we need to provide a certain medication in its enteric coated form or controlled release form? So this is because now the medications, when they are given orally, they are exposed to different types of external factors which could greatly affect their absorption. So one of these is the low pH range, particularly in the stomach, the digestive enzymes, intestinal microflora, and the ingesta that vary greatly among species. Of course, these can vary according to the type of the animal, the species of the animal, whether the animal is a monogastric or a ruminant animal. So every animal has a different physiology in terms of its digestion, digestive system, digestive microflora. That is why it is very important to protect the active ingredient within the drug so that it can be absorbed in the body and it can induce an effect that is indicated for that particular drug. So what happens when the drug is within the GIT? So when the drug is absorbed from the GIT, mostly in the intestine, particularly in the duodenum, it enters the portal circulation and passes through the liver before reaching the systemic circulation. So this is what we call the first pass metabolism, where in the drug, before it will reach the systemic circulation, it will still be metabolized, particularly in the intestine as well as in the liver, so that its bioavailability will be reduced and only a fraction of its original form or original quantity will be available in the systemic circulation. So what do we mean by enteric coating? So again, for those orally administered drugs, enteric coating is applied. And when we say enteric coating, this is a barrier that is applied to oral medications that controls the location in the digestive tract where it is absorbed. This is a useful strategy for the oral delivery of drugs. Example of this is insulin, which rapidly degrades in the stomach. So it also resists the solution under acidic conditions, but it is freely soluble at the more basic conditions of the intestinal tract. So enteric coatings are employed when the drug substance is inactivated or destroyed in the acid secretion of the stomach, or is particularly irritating to the gastric mucosa, or when bypass of the stomach substantially enhances drug absorption. So those are some of the reasons why enteric coating is very important when it comes to orally administered drugs. So the slides to follow, we will enumerate the indications or the specific reasons for the application of enteric coating. So the first is that is indicated to protect the acid level drug substances from the acidic pH of the gastric acid. Example of this are the erythromycin, pancreatine, and omeprazole. So in the case of erythromycin, so again, erythromycin is an antimicrobial drug. In terms of its oral absorption, it can easily be destroyed at acid pH, so that it is given as an enteric coated tablet or an acid stable ester. Another reason is to prevent gastric distress or ulceration or nausea due to irritation caused by certain drugs such as aspirin and certain NSAIDs. So one of the major adverse effects of the administration of NSAIDs or aspirin is the development of GIT ulceration. So one of the reasons to apply enteric coating is to prevent this from happening. Another very important reason is to deliver drugs that are optimally absorbed in the small intestine to their primary absorption site in their most concentrated form. Another is to provide a delayed release component to repeat action tablets. One of the example of a drug that is available in its enteric-coated form is the erythromycin enteric-coated tablet. So erythromycin is a macrolide antibiotic that is a bacteriostatic. It is used to treat bacterial infections. Why do we use enteric coating for this tablet? So enteric coating is used because, particularly in this drug, erythromycin, because this drug is inactivated in the stomach, and it is inactivated by the gastric acidity in the stomach. It also permits efficient absorption of the antibiotic in the small intestine of the patient. This is the rationale of enteric coating in the medical field. So we have here the stomach and we have here the intestine. So enteric coated drugs do not dissolve in the acidic condition of the stomach, whereas enteric coated drugs will readily dissolve in the alkaline pH of the small intestine. So therefore, the pH of the particular segment of the digestive tract will influence the solubility, the absorption of this particular enteric-coated drugs. So this diagram shows the different segments of the GIT with its corresponding pH range depending on the pH, or rather depending on the species of the animal. So of course we have here the gastric compartment. We have also here the small intestine, the colon, and the rectum. So in the case of the stomach, it has a pH range between 1.6 and 7.2 in terms of the small intestine, particularly on the duodenum. It has a pH of about 6 to 7. For the colon, now of course, it will vary according to the segment. For the ascending colon, this is the pH range, and for the descending colon, this is the pH range. And it is said that the dissolution rate of the coating of the drug is affected by these factors. So number one of that is the pKa of the polymer. We also have the pH of the medium and the ionic strength of the medium. So the pH of the medium refers to the pH of this particular compartment, of this the GIT. So for example, in the case of the stomach, its pH may range from 1.6 to 7.2, which is generally acidic, while for the pH of the small intestine, it can range from 6 to 8, which is towards the basic side. So these factors will influence the dissolution rate of the enteric-coated form of the drug. So we have here a comparison of two drugs, drug B and the drug A. Now, in terms of their dissolution rate as well as their absorption within the GIT. So this is illustrated through an area under the curve graph in this corner of the diagram. So in this case, the drug A and the drug B, so ito yung drug B, this is the blue one, the drug A is the red one. So yung kanilang concentration versus time after dosing is plotted in an area under the curve graph. So what is an area under the curve? Area under the curve in pharmacokinetics is the area under the plot of plasma concentration of a drug versus time after the dosage. So the x-axis here represents the time after you administer the particular drug, and the concentration, the y-axis represents the concentration of the drug after dosing. So what does it give to the researcher or to the pharmacologist? So the area under the curve gives the insight into the extent of exposure to a drug as well as its clearance rate. So in the area under the curve graph, we have here a particular portion wherein you can identify how the drug will be absorbed and up to what extent, and also the clearance rate of this particular drug. So when we are going to compare the area under the curve, the absorption and the clearance of the drug A and B in the different segments of the GIT, so we can say that within the stomach, the drug B has a lower area under the curve, meaning lower absorption rate, lower absorption as compared to that of the drug A. Now, the drug A here is located in the small intestine. So the absorption of the drug in the small intestine was measured versus its absorption in the stomach. So we can say that this particular drug has a greater extent of absorption in the small intestine as compared to the stomach. A while ago, we used the area under the curve concept in order to describe the absorption and the elimination of the enteric coated drugs in the different segments of the small intestine and the GIT. So we have compared two drugs, drugs A and B, in terms of their absorption and elimination in the stomach and the small intestine. So we have seen that in the small intestine, there is greater absorption of the drug compared to the stomach. No, that is because of the pH of the medium or the environment. So what is the area under the curve and what are its components? So in this slide, we are going to determine what are the components of this area under the curve concept of pharmacokinetics. So the y-axis in this particular example relates to the concentration of the drug in the blood. So that is the amount of drug that is present in the blood, and the x-axis represents the time after the dose is given. So the point here refers to the time that the drug is administered. So as you can see here, the ascending point from this point here up to the point here refers to the absorption of the drug, and from the Cmax, which is the highest concentration of the drug in the blood, up to the point wherein the concentration of the drug in the blood wanes and it reaches its lowest point, or the C mean, represents the elimination rate, elimination of the drug. Again, the Cmax represents the highest concentration of the drug in the blood, and we also have here the lowest concentration point of the drug in the blood is the C sub min, or C mean. We also have here another very important parameter in pharmacokinetics is the half-life. That is the time at which the drug has lost half of its maximum concentration. So the area under the curve represents the overall drug exposure of the patient to the drug, and that is abbreviated as AUC. It is a measure of how much drug reaches the patient's bloodstream in a given period of time. So the information is useful for determining the dosing and for identifying potential drug interactions. So this is another representation of the area under the curve concept of pharmacokinetics that has been used, that we used a while ago in describing the absorption and elimination rate of our enteric coated drugs. So again, the y-axis represents our drug concentration, and the time after dose in hours is represented in the x-axis. So some of the parameters that we can get out of this are the Cmax, the highest point of the graph, which is the maximum concentration. This is the maximum concentration that the drug will be able to achieve in the body relative to the time, or the Tmax. So the Tmax is the time Cmax happens. The Cmax may relate with some side effects. We also have here the area under this curve here represents the AUC, which is the field area here. This area here, the whole area represents the AUC. That represents the overall drug exposure of the patient. We also have here the very important one is the half-life. It is how gradually the line comes down. So that is the half-life. So the time for drug concentration to fall by half. For example, it took 2 hours on the x-axis to go from 6 to 3 on the y-axis. So in this case, we have here a representation of our half-life. So an example of that is it took 2 hours on the x-axis to go from 6 to 3 on the y-axis. So we have here our parameter no, on the y-axis, the 3. We have here the 6 and the 3. Ito yung 3. So 4, 5, 4, 5, 6. So dito yung 3. 3 tapos 6. So when we are going to compare how long would it take for a drug to be eliminated in the body when the concentration is from 6 to 3 on the y-axis. So it would take about, so dito tayo magtitingin, dito siya. So it would take 2 hours. So titingin tayo dito, 2 to 4. So that would take 2 hours in order for the drug to be eliminated from a concentration of 6 grams per ml to 3 grams per ml. So 2 hours yung kakailanganin para ma-eliminate yung drug. So that represents the half-life of the drug. So of course, the higher the value, the longer is the half-life, the shorter the value, the smaller the value of the half-life, of course, the faster would it take for a drug to be eliminated in the body. We also have here the lowest point of the line or the curve is the C-min, the minimum or the trough concentration. It may relate with, for example, with anti-HIV effectiveness. That is only an example. So how do you get the area under curve? So of course, in the medical field, the way to get that is to collect blood every 1 or 2 hours. So in this case, I think they collected the drug every 2 hours in order to determine the concentration of the drug in the blood samples. So right after a person or rather a patient takes a dose up until the next dose is due. So in each blood sample, the concentration of the drug is measured. Then all the drug concentrations are put into a graph based on the time after the dose that they were collected. So ito yung yung time of collection. So after 2 hours they collect blood, and after 2 hours na naman, up to the time that the drug concentration in the blood is up to its minimum. So the coating of the enteric coated drugs are made of polymers. The enteric film coating polymers are polyacids, and typically they only dissolve in water above a pH of 5 to 6. These polymers are selected for their ability not only to form robust coatings that adhere strongly to the tablet surfaces, but also to permit rapid drug release from the dosage form once it passes from the stomach into the small intestine. So this graph here represents the drug release in terms of the pH of the medium or the solution. So as you can see here, now this is the percentage. The y-axis represents the percent of the drug that is released, and the x-axis represents the time after the drug is administered. So this from this point to this point, this represents the time that the drug stays on this particular medium with a pH of 1 to 2. And after that, after 2 hours, the drug will go through another compartment with a pH of 6.5 to 7.5. So as you can notice here, the drug was only released, or the drug was only dissolved once it reaches the compartment with a pH of 6.5 to 7.5. So coating has solubility in water triggered by the pH. So the pH was able to trigger the release of the drug from its dosage form. So this can be applied also in the tissue compartments of the body. So this area here represents the small intestine, and this area here represents the stomach. Because the stomach is basically acidic in nature, and the small intestine is basic. So it has a pH of 6.5 to 7.5. So this only means that the enteric coated tablet will only dissolve once it reaches the small intestine with this particular pH range.